Ever felt like your emotions were on a roller coaster you couldn't get off? Or maybe you've been told you're too sensitive or overreacting. Maybe you've been labeled as having borderline personality disorder or called borderline. Sadly, some people throw this term around as an insult, but there are several disorders that mimic the symptoms of BPD, causing people to mistakenly give you that diagnosis. Today, we're looking at 5 of them. I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. Borderline personality disorder is a complex mental health condition characterized by intense, unstable emotions, fear of abandonment, unstable relationships, impulsivity, identity disturbances, and self-harm or suicidal behaviors. Diagnosing BPD can be challenging because of the overlapping symptoms with other disorders. Also, there is the issue of gender bias. Women are more likely to be called borderline over men, probably because people tend to associate the symptoms with feminine traits. This gender bias does affect other personality disorders, as men are more likely to be considered narcissistic or antisocial, probably because of the level of aggression and hostility that can come with these disorders are seen as masculine traits. So this gender bias can lead to women being labeled as BPD when they might actually be dealing with other conditions. As we go through this list, keep in mind that an accurate diagnosis requires a comprehensive evaluation, usually by a qualified professional. And even then, the professional has to keep their gender-based assumptions in check. So here we go with the top 5 conditions mistaken for BPD. First on our list is attention deficit hyperactivity disorder, or ADHD. ADHD is a neurodevelopmental disorder that might seem worlds apart from BPD, but there's actually quite a bit of overlap. Here are some of the similarities. Impulsivity. Both conditions can involve acting quickly without thinking about the consequences of the actions, or starting something without thinking through all the steps needed to see it through till the end. Then there's emotional dysregulation. People with ADHD and BPD can experience intense emotions and mood swings. ADHD is thought of more as affecting your attention and focus, but the emotion regulation is part of the executive functions that can be impaired with ADHD. I talk more in detail about this in another video that I'll link to this one. And then another similarity is relationship difficulties. Both ADHD and BPD can cause problems in maintaining stable relationships. Some of the key differences are ADHD symptoms typically start in childhood, while BPD usually shows itself in adolescence or early adulthood. That's usually when the personality disorders start to show themselves, in the late teens or early 20s. ADHD involves persistent inattention and/or hyperactivity, which aren't core features of BPD. And then the fear of abandonment that's central to BPD isn't typically seen in ADHD. Number 2, autism spectrum disorder, or ASD. ASD is another neurodevelopmental condition that involves differences in social communication, sensory processing, and restricted or repetitive behaviors and interests. And these repetitive behaviors might include strict adherence to routines or intense focus on specific topics. It's typically diagnosed in childhood, but many people, especially women and those with milder symptoms, may not be diagnosed until adulthood, which can then lead to confusion with other conditions like BPD. The similarities with BPD include social difficulties, particularly with relationships, emotional regulation issues. People with ASD may have intense emotional reactions similar to those seen in BPD. And then the identity issues. Some people with ASD struggle with their sense of self, which can resemble the identity disturbance in BPD. Here are the differences. ASD is a neurodevelopmental disorder present from early childhood, while BPD emerges later. BPD doesn't have the persistent deficits in social communication and restricted, repetitive behaviors and interests, which are characteristics of ASD. And then the intense fear of abandonment seen in BPD isn't typically present in ASD. Again, gender plays a role here. Women with ASD are often underdiagnosed or diagnosed later in life, and their symptoms might be misattributed to personality disorders like BPD. Number 3, complex post-traumatic stress disorder, or C-PTSD. C-PTSD develops in response to chronic, long-lasting traumatic experiences such as childhood abuse or neglect, domestic violence, or living in a war zone. Persistent bullying, especially during the formative years, can also lead to C-PTSD because it can profoundly impact a person's sense of safety, self-worth, and ability to form healthy relationships. The similarities with BPD are emotional dysregulation, difficult or unstable relationships, and identity issues. CPTSD can create a negative self-concept which can resemble the identity disturbance in BPD. Here are the differences. CPTSD is directly linked to a history of prolonged trauma, while BPD may or may not have a clear traumatic origin. CPTSD typically involves symptoms like intrusive memories and avoidance related to the trauma, which aren't characteristics of BPD. The intense fear of abandonment that's a big part of BPD isn't a core feature of CPTSD. So when trying to tease this out, it's important to consider your trauma history. Women are more likely to experience certain types of prolonged trauma like childhood abuse or domestic violence that can lead to CPTSD, which then might be misdiagnosed as BPD. Number 4, bipolar disorder. Bipolar disorder is a mood disorder characterized by alternating periods of depression and mania or hypomania. In these states, whether it's depression or mania, you experience significant shifts in energy, activity levels, and mood that significantly impact your daily functioning. Here are the similarities to BPD. The mood instability. Both conditions involve significant mood changes. Impulsivity. During manic or hypomanic episodes, people with bipolar disorder may engage in impulsive behaviors similar to those in BPD. And then the relationship difficulties. The mood swings in both conditions can strain relationships. Some of the differences are, with the mood episodes, bipolar disorder involves distinct episodes of depression and mania or hypomania. The mood changes with BPD are more rapid, reactive changes that may not last very long, like a day or so. You can feel low, but not necessarily be experiencing other depressive symptoms. To be in a depressive episode, you need to have a constellation of depressive symptoms that last at least 2 weeks. Manic episodes need to last a week and 4 days for hypomania. The emotional shifts with BPD can occur within hours or days. Also, bipolar disorder doesn't usually involve the fear of abandonment and identity disturbances that can occur with BPD. And then number 5, one that you probably didn't expect, is narcolepsy. Narcolepsy is a chronic neurological disorder that affects the brain's ability to control your sleep-wake cycle. Its primary features are excessive daytime sleepiness, often accompanied by sudden loss in muscle tone that's triggered by strong emotions, and these attacks are called cataplexy. Other key features are sleep paralysis and vivid hallucinations when falling asleep or waking up. It presents similar to BPD with the emotional lability. Narcolepsy can cause sudden, intense emotions that might be mistaken for BPD mood swings. Both conditions have relationship difficulties. The symptoms of narcolepsy can strain relationships and cause you to withdraw socially. And then there's impulsivity. With narcolepsy, the sleep attacks, which can be dramatic at times, might be interpreted as impulsive behavior. Here are the differences. Narcolepsy is fundamentally a sleep disorder with the symptoms of excessive daytime sleepiness and sudden loss of muscle tone. People with BPD may have sleep troubles like insomnia, but not the excessive daytime sleepiness unless you have another condition. For example, sleep apnea can also cause the daytime sleepiness. But the cataplexy, the loss of muscle tone, is definitely not a feature of BPD. Another difference is the emotional experiences in narcolepsy are usually directly tied to the sleepiness or the sleep attacks. With BPD, the emotional stability is pervasive or persistent and independent of a sleep attack. And like the other disorders, narcolepsy doesn't involve fear of abandonment and identity disturbances. So, as we've seen, several conditions can present similarly to borderline personality disorder, including some unexpected ones like narcolepsy. It's important for both clinicians and patients to be aware of these potential overlaps to ensure accurate diagnosis and appropriate treatment. A thorough clinical evaluation is always necessary for a proper diagnosis, and if you're concerned about your mental health, please seek help from a qualified professional. But here's a caveat. It's not that easy to diagnose a personality disorder from one conversation. It's possible, but the clinician needs what we call longitudinal information that covers different periods of your life and different circumstances, because anyone can have situational and temporary periods of emotional disruption. For example, let's say you're in your early 20s and you're in a job that you hate and in a relationship with someone who tears you down all the time. In that setting, you could become unhinged and really make a mess of your life with a series of bad decisions. But then your circumstances change, you change careers, you get out of that bad relationship, and you settle into a comfortable rhythm. It's like you righted the ship and now you're on a better course. If you just analyze that one slice in time, someone could say that your life was a mess because of a personality disorder. But now, 10 years later, you don't have that level of dysfunction. That was just a difficult period for you that you had to mature out of. So we have to allow for random seasons of dysfunction. But the dysfunction that comes from a personality disorder is constant. It can fluctuate in intensity, but it doesn't just go away because you change a few life circumstances. So a clinician will likely need to hear a few stories about your life to conclude that your symptoms stem from a personality disorder. Watch this video for more on borderline personality versus bipolar disorder, and this other one on executive function. Thanks for watching today. See you next time.